Good afternoon, everyone. I'm delighted to welcome Dr. John Gilmore from FarmLab in County Roscommon. John founded FarmLab in 2012, and as part of Virtual Vet World Antimicrobial Awareness Week, John's going to talk to me about diagnostics and the pivotal role they play in tackling antimicrobial usage, correct diagnosis, and trying to reduce antimicrobial usage in farm animals, in livestock production, and along the agri-food chain. John, you're very welcome. Thank you very much for joining us here this afternoon. And over the next half an hour or so, we'll go through, some of the most significant and helpful diagnostic tools currently available and the service that you offer out of FarmLab in Elphin in County Roscommon.
Thank you, Mary. Thanks for bringing me on here today. It's my pleasure to get the opportunity to talk to you.
Very good. So our main focus really will be cattle production, livestock production, because at the end of the day, I know whilst you do some pig and poultry and equine and companion animal, it really is a farm lab and you're focused on livestock production. So let's kick off with the most common and useful types of diagnostics that FarmLab currently offer to your farming and vet clients.
Yeah, so I suppose as you've said there, Mary, we offer a full range of tests. Basically what FarmLab does, I suppose with my background coming largely from working in the farm animal side and a bit in the equine side, that's where we have tended to focus this on, is on the whole area of improving health in the livestock sector. So we offer a full range of tests there to look at all the different factors or different diseases or different disease syndromes that can impact on health at farm level. So basically that goes from looking at the likes of antimicrobial use and through the use of culture and sensitivity testing. We do a lot of parasitology testing. We do a lot of disease screening using the likes of ELISA test, serology, looking to see what kind of levels of disease are on farm. And then we have some PCR tests where we look specifically for different agents that are present on the farm. And then as part of the overall health package, then we also offer tests to look at things like nutritional status, so through the use of the likes of metabolic profiles for assessing cow health and energy balance, and also mineral profiles and biochemistry testing and that sort of stuff. So basically, most of anything that can impact generally on the health of animals at farm level, that's what our business is.
Very good, John. So it's good to know that this is an Irish business set up in rural Ireland that is going well in these challenging times. We might focus a bit on mastitis. You mentioned culture and sensitivity there. I'd like to hear a bit more about, the value and benefit of knowing what antimicrobials are working in clinical cases. So, I've heard of farmers who are concerned that a certain antibiotic is not as effective as it once had been on their farm, and they kind of automatically jump up to what is deemed a more powerful antibiotic. But that's not necessarily always the case. So could you talk me through, taking a sample for culture and sensitivity, what you do with that, and how you communicate that information, and how the farmer and his vet should use that to have a more effective antimicrobial treatment program on their farm if required?
Yeah, so I think there's two key things in relation to when we're talking about the use of diagnostics and mastitis on farms. One of them is the identification of which bacteria are present on the farm, and the other one then is assessing which antibiotics or antimicrobials are effective against those particular bugs or bacteria that are present on that farm. And I suppose a lot of the time people tend to focus on the second one without maybe taking the first one into full consideration. So what I mean by that is people will, if they're talking about culture and sensitivity, will often just look at which antibiotics are used, which is a very important element of what we're talking about. But what's equally important is to identify kind of a profile of which bacteria are present on a particular farm, and the patterns of bacteria that are involved in mastitis or subclinical mastitis or elevated cell count on those farms. So I suppose that's part of the overall package when you're looking at use of diagnostics to help in the management of mastitis on farms. So to give examples, some farms, what we've seen over the last number of years has been that there's probably been a shift in the importance of different bacteria or bugs on different farms. So traditionally, Staphylococcus aureus would have been a very significant bacteria on a lot of farms and had high levels of had a highly contagious element. So what I mean by that is that it would have spread a lot in the milking parlour, and that would have been the main focus for controlling that bacteria on farms. What we're seeing now over the last number of years has been that there's been a relatively bigger increase in terms of other bacteria. So likes of Streptococcus ubris would be a very common bacterial isolate now on farms, and as would these coagulase negative staphylococci, and a little bit of a move towards other types of coliform bacteria and everything else as well. So well, that's all quite technical, but it does, I suppose, if you are in the habit or the process or system, you have a system in place whereby you're routinely monitoring which bacteria are causing problems on the farm, then you get an overall picture of which bacteria are, which bugs are there. And then as part of that, then, as you identify the bugs, you can get a profile of which antibiotics, which antimicrobials are working on that farm or which ones aren't working on the farm. And it can guide you in treatments and in management of the disease, I suppose, as much as anything. Now, I suppose just to phrase that in terms of, I'm not saying that culture and sensitivity is the be all and end all in terms of mastitis management. It is only one element of it, but it's probably an important element of it, and something that sometimes gets overlooked in terms of the overall picture when we're looking at why there may be elevated cell counts on farms, or why there's a lot of clinical mastitis on farms.
Yeah, I suppose it's always said that you can't manage what you don't measure, and if you're not measuring the level of antibiotics or the type of antibiotics active in your herd, well then you're not in the best position to manage the situation and find out which antibiotics will work to control those bugs as part of the overall mastitis action plan, if you'd want to call it that. There's new legislation coming in with regard to the prescribing of antimicrobials, and I think the veterinary relationship with farmers in terms of mastitis control, there needs to be more engagement there really, and more diagnostics as part of the overall mastitis package. The categorization of the antibiotics as they are from the European Medicines Agency of avoid, restrict, caution and prudence, those four categories. I welcome your thoughts on the effectiveness of those antibiotics, because there seems to be a preconception out there that if you're in the top category of avoid, that they're the most powerful antibiotics, but that's not necessarily the case. They're just the antibiotics that are being restricted because they're required for human health. And just because an antibiotic is in the prudence category, the lowest critical antibiotic category, that doesn't mean they're ineffective.
Absolutely, yeah. And I suppose, having worked in veterinary practice for a long time now at this stage, in excess of 20 years, I suppose. I would be very conscious of, you know, that thought process around the use of antibiotics, and, you know, the tendency, whether that's amongst ourselves or maybe amongst farmers, to say, well, to use something, as you say, stronger. Whereas, you know, that the stronger may not necessarily, just because, as you say, it's in one of those restricted categories where we're saying that those antimicrobials in those categories are particularly important for human health, and therefore we should be reducing their use, or maybe not using them at all, depending on the category. That doesn't necessarily mean that in a lot of cases the drugs that we have to use prudently, bear in mind whether we're using them from any category, whether that they're not actually effective. And we mentioned there a few minutes ago about the different, in the case of mastitis, the more common bacteria which are causing problems on farm. And I suppose we mentioned Streptococcus and we mentioned Staphylococcus aureus. So in both of those cases, in the majority of situations, those bacteria, probably one of the more effective drugs for treating them is just it. And again, you know, that's, I suppose, our tendency, I said there, is just penicillin, but it is actually penicillin. And the fact that it is just penicillin doesn't make it any less effective than a drug from one of the, what would be deemed maybe the top shelf category of, you know, drugs that we shouldn't be using. So in those situations, we're going to get equally as effective results from the use of some of the antibiotics that we have at our disposal, and, you know, which we should be using more of, and to move away from that tendency of thinking that we're going to go with something stronger, because in a lot of the drugs that we're dealing with, it may not necessarily be stronger at all. And I suppose we're all cognizant of you know, certain issues with the likes of Staph aureus and that sort of stuff, and resistance. But in actual fact, in the case of mastitis, if we do the culture and sensitivity on those isolates from most farms, the actual level of penicillin resistance with Staph aureus on farms is actually quite low in the case of mastitis. And in the case of Strep uberis, which is one of the more common bacterial pathogens now on farm, there's very little, there's very extremely low levels of resistance to penicillin. So yes, you're right. In the case of, you know, if we can know what's there, know which drugs are effective, and select what is probably the most appropriate and most effective drug, as well as being from a category that's, you know, of benefit from the point of view of protecting our drugs, which are of highly critical importance to human health. So yeah.
Yeah, absolutely. Like, it's funny, we really do need to move away from the mindset of, oh, just penicillin, because it's a powerful antibiotic, even
Absolutely.
if it's the least restricted category. Which brings me on to Mycoplasma mastitis. You know, whilst in practice, I'd experienced with a few bad outbreaks of Mycoplasma mastitis, and, you know, as the veterinary practitioner was called in a little bit later to the scene, and the farmer in question had used fairly hefty doses of strong antibiotics, which were totally ineffective against Mycoplasma. And actually what worked well on that farm was just oxytetracycline. You know, and it never, if we had done culture and sensitivity at the beginning and had identified Mycoplasma, and you have the Mycoplasma PCR test, don't you?
Yeah.
FarmLab,
We do, and I suppose that is something. Now, in actual fact, it's surprising. There's a relatively high degree of awareness amongst farmers about Mycoplasma and the potential damage that it can cause in herds. But I suppose what people as you say, they're probably slow about maybe going about the diagnosis of it and to identify whether it's actually present on farm. And yeah, we use a PCR test for Microplasma, and that can be used on the bull tank, or it can be used in individual cows or pooled samples from multiple cows. And I suppose what that allows you to do is it gives you an early and a rapid and a highly sensitive or accurate way of identifying if Mycoplasma bovis is present on farm. And as you rightly say, if it is, then the management of that is different than the conventional bacteria which cause mastitis on farms. And I suppose if you, as you mentioned or alluded to, if you identify that that's there present, if that's there early in an outbreak, then your management and your approach can be much different, and your wasteful use of antibiotics in treating a disease that's very difficult to treat can be managed in a different way. So, but again, it's about having the knowledge that if you suspect or you want to screen for Mycoplasma on farms, then conventional bacteriology is probably not a very accurate way of doing that. And to be aware that if you select to do the PCR test, then that is a very useful technique for identifying if Mycoplasma is present on the farm or not.
So really, to summarize the mastitis situation from a diagnostics perspective, we should be taking milk samples from clinical cases and have a lab such as FarmLab conduct culture and sensitivity, as well as doing a PCR test on the milk sample to see if there is anything else like Mycoplasma bovis going on. And I'm cognizant of the fact that, you know, people are hearing about PCR testing in relation to COVID. It is just a testing mechanism whereby you're testing for the DNA or the RNA fragments, the genetic components of the organism, and you have that system in place in FarmLab.
Yeah. So, what it is actually it's technologically it's a quite technologically advanced method of looking for a particular disease, but it's something that we do for a wide range of diseases here in FarmLab. But yes, you're right. You're basically looking for the DNA of an organism, and sometimes I equate it to a little bit. I don't know whether you ever watched CSI or whatever, where they're going looking at a crime scene and they're looking for DNA from the suspect or from the criminal who may have been there. It's the very same thing here, apart from the criminal in this case is the Mycoplasma, or is the bacteria that we're looking for, and we're looking for the DNA that it has left behind at the crime scene. So it's basically the same idea. We're using the same technology. We're looking for DNA from the bacteria and to see if it's here. And no more than what they can do in forensic investigations now, we can identify very low levels of DNA from these bacteria. So if even a small number of cows are going into a bull tank, then we can detect it using the PCR method.
Very good. That's a great analogy. You might have to rename yourself FarmLab CSI. So that's on the
well, you just mentioned there, Mary. Well, just to give people maybe some practical way of doing this, and rather than being too, I tend to be maybe too theoretical, but I suppose you mentioned about what people should be doing and taking samples. And yes, you're right, people should probably be taking samples. And what we encourage to do is that even throughout the lactation, if you have a cow with clinical mastitis, or if you've got a cow that shows up very high on a reading on a cell count, then take the sample from her. If you're in general things are going okay, then you may not necessarily need to rush to the lab with that sample. But if you build up a bank of samples throughout the lactation, and if it looks like you're running into problems with the mastitis situation, or you're concerned that yes, you're using a lot of antimicrobials and you need to look and see what's going on, and you've had 3 or 4 cases, then if you have those samples stored in the freezer, you can take them out, send them to the lab, and they can be analysed to see what's going on and which antibiotics are working. Or equally, at this time of year, when we come to drying off, you can take those samples, and it gives the vet and the farmer a good indication of what type of what kind of bugs are there present, and which treatments they need to use. And I suppose ties into the whole area that we're hearing now about reducing our use of blanket dry cow therapy at drying off and moving towards more selective dry cow treatments.
Very good. And really, selective dry cow therapy is the way forward. You know, the use of blanket dry cow therapy looks like it'll be a thing of the past when the new legislation comes into force in January 2022. And we'll have to be more selective in our dry cow therapy. Any thoughts on that before we move on to respiratory disease?
I think the thoughts on that are that, you know, as you rightly say, post 2022, you know, people are going to be forced into a situation where, you know, effectively you will be discouraged or prevented from giving antibiotics to a healthy animal. So, you know, if an animal doesn't have mastitis, or it doesn't have infection in the udder, then the idea of putting antibiotics up into those cows, if there isn't a legitimate reason for doing so, is going to be something that's, you know, as I said, we're going to move away from the current situation where on a lot of farms every cow gets antibiotic treatment at drying off. And I think that to move towards that situation where people are going to be forced to have to do selective dry cow therapy, you know, they need to be building that into how they manage mastitis now on farms. Part of that is knowing, you know, your cell counts for your cows, doing your milk recording, but also part of it is, as we've discussed in relation to those clinical mastitis cases and the high cell count cows, knowing what bacteria are present on the farm, knowing if you have a highly contagious pathogen such as Microplasma bovis on farms, knowing if maybe you have highly contagious pathogens that are going to cause problems in the milking parlour, like Staphylococcus aureus or maybe Strep agalactiae in certain cases. But as you rightly said earlier, without measuring, without knowing and analysing what's there, then you're heading into that situation quite blindly, you know.
Yes, you really do need to know what's going on. And just one other thing on that, John, if you don't mind. There's this phenomenon of heifers calving down with high somatic cell counts. And there seems to be a concern that there is a level of infection in these heifers. Now, from my brief understanding of it, I understand that this is kind of a natural inflammatory reaction that these heifers are calving down with high somatic cell counts, showing up in the California milk test as having a significant somatic cell count, but that in actual fact, it's a normal commensal and it's not necessarily affecting production throughout the lactation. Have you any insights into that or thoughts on that situation?
Yeah, I think that there has been a move over the last short period of time. So I suppose over the last recent years, to look at every cow when she's calving down, but particularly with heifers, there's been a lot of talk maybe about checking heifers before they're put into the bull tank, checking to see whether they're positive on a California mastitis test, checking to see whether they have high somatic cell counts. And this is something, I suppose, that to my mind, or, you know, as far as I know, is quite a recent phenomenon. And a lot of these heifers were calving down 10 years ago and there was no heat pass them, they went on fine. And now we're finding out that a lot of these heifers are calving down, and yes, they are turning the paddle, and they are giving the impression, or maybe they do have high cell counts. And my concern in relation to those is, why do they have a high cell count? And like, there are targets there for farms, and they're being encouraged to meet them. And you know that heifers, less than 15% of your heifers shouldn't should calve down with an elevated cell count and that sort of stuff. And farmers are being encouraged to do that, which is good. But I think that again, we talked about, operating blindly to a certain extent. You need to know what is causing that elevated cell count. And if it is a true mastitis pathogen, or the use of a technical word, or an organism that does cause clinical mastitis, or that is a true, a true problem on farms, then that's fine, and that animal needs to be treated probably. But what we've seen, particularly with these heifers that do come in for culture and sensitivity testing, in a lot of cases, majority of cases, I would think, in heifers, they're calving down with these CNS bacteria, which is a very broad, very big family of bacteria, which can at times cause mastitis. But as you rightly say, there is an element that they can be a commensal, and they can be part of the normal makeup of the udder or the teat canal of these heifers. And in a lot of cases, to my mind, there's some of these animals are being treated with antibiotics, and there is no need to do so. And I think that, probably there isn't a huge awareness around that issue at farm level currently anyway.
Okay, so this is something that really needs to be looked into a bit more, because we can't really be using blanket antibiotics without culture and sensitivity, seeing what's active in the herd, seeing why these heifers or cows have high somatic cell counts. As we move forward and move towards January 2022, this is going to become even more important, really, in terms of, measuring, managing, finding out where an antibiotic is needed, if it's needed, and then what antibiotic is the most prudent and responsible one to use in whatever circumstance may arise. We mentioned PCR there, John, in relation to mastitis sampling. But I suppose when PCR first became available in Ireland, I think it was around 2012, 2013, from a veterinary perspective, when the Central Veterinary Lab introduced PCR for respiratory viruses. Are you conducting PCR testing for respiratory viruses in FarmLab? And, what's your thoughts on effective control and treatment and diagnosis of respiratory disease in both beef and dairy cattle?
So the answer to are we doing the PCR testing? Yes, we are. And as we mentioned earlier, basically a way to know whether certain viruses or bacteria are present in disease outbreaks. And that has a big application across a lot of diseases, including mastitis or respiratory, or even abortion, or infertility issues on farm. But in the case of respiratory disease, it is a useful technique. Again, it comes down to the vet working with the farmer, taking samples from the animals, trying to identify if there are viruses there. And if there are viruses there, as you mentioned with COVID earlier on in your discussion, no more than the situation with human viruses, the only tools we have for managing these viruses on farms is the use of vaccination, because antibiotics don't work against viruses. They've never worked. They were never intended to work against viruses. And there is a certain level of awareness around this, but there are still a lot of viral diseases that are trying to be managed by the use of treatments including the use of antibiotics. And a much better approach, and an approach which would probably be more profitable and productive at farm level, would be to identify which viruses are causing problems and to put vaccination programs in place for those viruses, and to again I suppose identify the problem quickly and institute control measures or vaccination plans quickly as well, especially in relation to respiratory disease, which outside of mastitis in the dairy herd, I suppose, if we talk about beef herds or store cattle or weanlings or whatever, you know, the big place where antibiotics are used in those group of animals is in treatment and management of respiratory disease, really.
So really, it's down to prevention is better than cure. And when a vet treats an animal or a farmer gives an antibiotic to an animal for respiratory disease, it's kind of 2 or 3 steps too late, really, isn't it? It's for the secondary bacterial infection. And really, if we were to look at managing respiratory disease better, it's about housing, ventilation, vaccination, and preventing the most common viruses. I know it's a while since I looked at the data now, but I know RSV and PI3 were always the most common viruses across all age groups in Ireland, and generally
Yeah.
no herd hasn't been exposed to them. So when you're sampling for viruses, for respiratory viruses, so the vet goes out, takes a sample, a nasal swab or blood sample, or what are we talking about?
A nasal swab. A nasal swab for that acute phase of the disease where you're trying to identify which viruses or bacteria may be there, and ideally taking that sample from a group of animals. So you improve your chances. Basically, no more than with COVID or with any of these viral diseases, the animal or the individual just sheds the virus for a relatively short window, depending on which virus we're looking at. So if you're able to sample from multiple animals, you improve your chances of detecting what's going on. And in most cases, that's going to have implications for management at herd level anyway. So a positive diagnosis from a group of animals gives you you know, an indication of which vaccinations you should be using. Equally, the likes of blood tests also have a role to play in monitoring antibody levels on those farms and seeing which viruses are present. And I had a discussion earlier today actually with a vet where we had some samples in, and we had looked at the whole nasal swab, the PCR side of things, serology for bloods, but also in that situation, there's a background problem there with another disease on that farm called tick-borne fever or anaplasma, and that is causing immunosuppression on the farm. And that's something that I suppose was found recently through the use again of a PCR test on that farm. And we have experience of that in our own veterinary practice. And unless that you identify that those sort of things are there, then, and you've got immunosuppression related to maybe that or something else, then it's more difficult to put a control program in for the whole thing. So I suppose the whole thing, rather than looking at just the PCR in isolation, it's part of looking at the whole health on the farm and, you know, identifying what issues are there and what stresses are there. And as you say, whether that's the housing, whether it's the nutrition, whether it's, and then the viruses that come in are part of that whole process.
Okay, so that's interesting, looking at the overall as opposed to just honing in on one specific disease issue at one point in time. And just before we finish up, because I'm conscious of time here, you mentioned earlier on, John, about the metabolic profiles that you do. Just could you give me a brief oversight of that? Like, what role do they have? Why would a farmer do this? When would he do it? How would he do it? And you know, what is the metabolic profile, and what do you do with that information when you get it?
Yeah, I suppose, you know, in the context of today's talk, where we're talking about antimicrobials, you know, we mentioned that mastitis is one of the big areas, one of the big disease-causing issues on dairy farms. And I suppose, you know, any of us that have worked in a cow, you know, a cow system or a dairy cow system or a suckler cow system, the other high stress time or the other time when cows are going to get sick is around calving. So in that, in those first probably 3 to 6 weeks post calving, that's when your problems happen, and when again we need to go in and treat with antibiotics, whether that's for treating for mastitis or maybe metritis. Some of these cows are getting dirty, getting these white white discharges post-calving. And I suppose where that, as you say, the metabolic profiles, where that ties in is an analysis of the overall nutritional status of the herd. So that forms part of identifying how much stress these cows are under at calving. That's one element of it. So what we're looking at is the level of negative energy balance that these cows have when they calve. So all dairy cows, they're high performance animals. They all go into a certain level of negative energy balance, which causes stress post calving. But it's the degree of that and the number of animals that are suffering from that in the herd is part of what we look at with the metabolic profile. The other thing we look at is the likes of calcium levels, and subclinical hypocalcemia is actually a very big problem in dairy farms. There's studies done there somewhere, when we talk about multiparous cows or cows that have had multiple calves, in excess of 50% of cows are suffering from subclinical hypocalcemia post-calving. Again, that doesn't necessarily always show up in cows actually going down with milk fever, but what it does show up in is things like cows getting displaced abomasums because the motility of their gut isn't good because the calcium levels are low. Also, we know that there's a much greater risk of cows getting metritis if there's hypocalcemia, again, because the uterus doesn't contract down properly, or maybe they're getting retained cleanings. And we also see much greater levels of mastitis. And again, some of that is related to the fact that calcium is so important in the functioning of muscles. We all associate it just with skeletal muscle and cow's ability to stand or not, but also even the closing of the teeth sphincter is a muscle that calcium has an influence on. And if that's left open, then those cows are going to be open to infection and get mastitis in that early calving period, where we end up using a lot of antibiotics. So again, that along with probably a good analysis of the nutritional status on the herd, whether that's doing a mineral profile or looking at the feed that's going in, is part of the overall health picture. As you said a few minutes ago, it's about looking at the thing holistically. It's about looking at all the things. So we're all conscious of the fact that the bacteria that cause the problem are part of the problem, but it's the other things that give the bacteria the opportunity to grow and thrive that are important as well in this fight to reduce our use of antimicrobials on farm. And unless we approach it as in a holistic way and look at all these factors, then it's going to be very difficult or impossible to actually reduce our overall usage of antimicrobials in those situations.
Yeah, very interesting. Like it is back to first principles, really, isn't it, John?
Yeah.
Look at how you're feeding your cow and your calves, make sure their nutritional status is right. And the metabolic profiles have a significant role to play there in seeing what the calcium levels are like and what their immune status is like. And it's back to prevention is better than cure. By looking at all the first principles of animal management and animal husbandry and nutrition, we can get ahead of the bacteria and not give them the opportunity to get established, and thereby reduce our reliance on antimicrobials, and which will just benefit us all, both in veterinary medicine, human medicine, and environmental medicine. So, John, thank you so much for your time this morning. I really appreciate it. I think from now on I'll refer to you as FarmLab CSI because it's got a nice ring to it. Thank you very much. Thank you for contributing to Virtual Vet's World Antimicrobial Awareness Week campaign. And I'm sure we'll catch up with you at some stage in the coming weeks. So thank you very much.
Thank you, Mary. Thank you very much. It's been a pleasure.